Hi, I'm Jo Skillman, I'm a plastic surgeon here at UHCW in Coventry, and this video aims to give you a bit of information about what may happen after your injury. This video is about people who've had a lower limb injury and the treatment that's required to help you recover from it. When you come into hospital with this severe injury, it can be limb threatening, and it's really important that each stage of your recovery and treatment is done properly. This involves a minimum of 2 operations. The first operation, which you'll have shortly after you've come in, is to assess the fracture or the break in the bone and the tissues overlying the bone. Sometimes these are also damaged and require reconstruction. After this first operation, your reconstructive operation will be planned, and this is usually a few days later. The bone is fixed and the soft tissue is reconstructed either with adjacent tissue or some tissue from somewhere else on your body that is then moved to cover the missing part of your leg. This operation is very long, it can take up to 12 hours, and after the operation you need to stay in bed with your leg elevated. You'll be in hospital for a minimum 10 days to 2 weeks after your injury. The process of recovery is a long one. It takes about 6 months to get your normal function back, and even 3 years to fully recover from the injury. I'd like to introduce you now to one of our patients, Jasper, who had a similar injury to yours. The video does include some photographs of his wound and of the reconstruction with the flap, and explains a bit about his experience of having an injury. I wish you all the best with your recovery, and now I'd like to hand over to Jasper.
Hey, so I'm 27, I've got a manufacturing business, and in June, around the end of the month, I had an off-road motorcycle accident. Part of the bike caught my leg as it was falling down and made a small cut in what we thought was a small cut in my leg to start with, and unfortunately broke both my tibia and fibula pretty much in half. And I was in the ambulance on the way to the hospital thinking to myself, well, I'll be in a pot for my best friend's wedding in 2 weeks' time, everything will be fine. I found out pretty quickly that it was going to have to be operated on, and I'd need a free flap and skin graft. Later, next day I went into theatre so that everyone could have a look inside and see what it was looking like. I came round from that first op, I think it was about 5 hours, and there was quite a lot of tissue that had been cut away from my leg, about that size. Given that the first incision was only about 1 inch long, it was quite surprising. It was then plated as well, just to keep the bone in place, to prepare me for the next op, which happened a couple of days later. So the second operation was long. From my understanding, it was about between 10 and 11 hours. So during that operation, orthopedics team put a nail inside my tibia, which was about as long as the bone, and that was done by lifting my kneecap up, I believe, and drilling down inside it. So I've got screws at the top and bottom of my leg. And then obviously plastics came in and they've cut a piece of muscle away from my opposite leg. And then some skin was grafted from the other side of my leg, which was kind of meshed and put over the top of it. Hospital for just under 2 weeks, I think it was 10 or 11 days. I'd seen it before I left. Obviously, there was a 5-day period where I couldn't move out of bed. That was quite intense. But the initial healing had to be done on the tissue before we started putting too much blood pressure on it. So that was quite an emotional journey to kind of handle. And it was very emotional the first time I dangled my leg off the bed, because that had been the next milestone for me. So 2 days after that, left hospital. I actually walked out with holding my crutches up. It was a bit of a I've done it kind of thing.
Yeah.
that didn't last very long. It was, the first few days were quite painful. Obviously, there was a lot of healing going on in the bone, and the graft site swelled up quite significantly. There was a lot of fluid coming out of it, and the dressings were having to get changed like on a daily basis. But the site swelled up to like that kind of size. It was quite big and shocking at times, and the way that the tissue was all healing at different rates, because it was, some of it was skin, some of it underneath was like just muscle or whatever it was. That was quite intense to watch, because it looked like something was going wrong at times, and actually it wasn't. And every time I came to hospital, everyone was saying that it looked really good, and I was looking at my leg thinking, does it?
Now you're about 6 months after, or a bit more than that.
Yeah.
Tell me how you're getting on, and I'll just show a picture of your leg, what it looks like now.
Really well. So I've not had a compression bandage on today. The shape's usually quite a lot slimmer, not this slim, but slimmer than it is at the minute. I can run 10k now, which I didn't think in June I was going to be able to do anywhere near this soon. But that's come with quite a lot of active training on it, to be honest, and a balance of not being too afraid of getting on my leg and training it, but also not being silly when it does hurt a lot. But there are a few pain barriers to push through, there's no doubt about that. But I do genuinely believe that keeping moving on it has been a big factor.
And when it was really swollen, putting it up helped to bring the swelling down, and the compression bandaging as well.
Definitely.
In some situations, we might use some tissue from the front of your thigh or from your back instead of from your inner thigh. In this situation, the tissue can be used in the same way to reconstruct any missing skin. It does look better to begin with because the skin is the same colour as your normal skin, but often it requires some revision surgery as it tends to be thicker than your normal skin in this area, and it needs a small operation at a later date to get the same contour. So I hope you found this video helpful, and it's given you a bit of information about the 3 phases of your recovery. The first one, assessment and clean-up. The second one, reconstruction. And I wish you well with your ongoing rehabilitation and recovery from your injury.
12 months ago today, I was told there was a chance I could lose my leg. Thanks to the doctors at Coventry Hospital and a solid mindset, we're now 15k into a 20k run, 3 months away from a marathon. It's all in the head. Good luck with the recovery.
Thank you to Jasper for sharing his story, and to you for watching the video. I hope you found it helpful. Thanks very much.